PLAB 2 List of cases. Respiratory system. 60-year-old man comes with cough and breathlessness for 2 weeks. Take a history, discuss the management. A 35-year-old homeless man with fever for 3 weeks, cough with sputum and breathlessness. Take a history, do an examination, and discuss management with the examiner. A 22-year-old football player has a wheeze every time he plays football. Take a history, do an examination, and discuss the management. Gastrointestinal. 70-year-old man with difficulty in swallowing. Take a history, do an examination, and discuss the management. 50-year-old man with abdominal distension for 6 weeks. The history, discuss the management with the patient. 70-year-old man with yellow skin and eyes. Take a history, examine, and discuss the management with the patient. A 40-year-old lady with abdominal pain and yellow urine. The blood tests show an ALT of 580, AST of 520, and the bilirubin is also elevated. Talk to her about further management. A 50-year-old man with diarrhea for 2 months. Take a history and discuss the management. A 60-year-old man admitted with pneumonia was tested positive for Clostridium difficile in his stool. He has been shifted to isolation ward and his son is concerned. Talk to the son and address the concerns. Genitourinary. A 25-year-old lady with burning urine and lower abdominal pain. Take a history and discuss the management and provide counseling to the lady. A 35-year-old man comes groaning with severe left loin pain. Take a history and discuss the management. Skin. A 25-year-old lady with dark itchy rash on her right shoulder. Take a history and discuss the management. Take informed consent for the surgery. The years. A 50-year-old lady with hearing loss in the right ear for 3 weeks. Take a focused history, do an examination, and discuss the management. A 20-year-old man complains of throbbing pain in the right ear for 2 days. Take a history, examine the mannequin, and discuss management with the patient. The eyes. A 60-year-old lady comes with sudden loss of vision in her right eye. Take a history, examine, and talk to her about the management. Bones and joints. A 70-year-old man with recent onset back pain. Take a history and discuss the management with him. A 70-year-old lady brought by the son with a fracture of the wrist after a simple fall at home. The hospital decided to send her home after application of the cast, but the son is unhappy. Talk to him and address his concerns. 80-year-old man who had a surgery for fracture ankle 18 months back has been admitted for pin removal. Do a pre-op assessment for day-care surgery and discuss the preparation for surgery and post-op care. Teach the medical student knee examination. A 60-year-old lady twists her ankle and has come with pain and swelling. The x-ray is normal. Talk to her about the management. Surgery. A 70-year-old man underwent hernioplasty 2 weeks back and has come with pus discharge from the wound. Talk to the patient. The infection rate in the hospital is the same as the national infection rate. Vascular. 70-year-old lady with recurrent falls over the past month. Take a history, examine her, and discuss the management. We're thinking about postural hypotension here. Take the patient's blood pressure. Psychiatry. A 25-year-old man is brought to hospital by the police. They say he went to the police station and said he did something wrong, but it was a false claim. Do a mental state examination and talk to him about further management. A 30-year-old lady is brought with a history of paracetamol overdose. Do a psychiatric evaluation and discuss suicidal risk with the examiner. A 70-year-old lady is brought by the daughter with a history of forgetting things easily. Do a mini mental state examination. The nurse brings you a 30-year-old lady admitted for a gynecological problem as she has concerns about her drinking. Take a history for alcohol abuse and talk to her about the management. A 40-year-old man has a drinking problem. Counsel him to stop drinking. Gynecology and obstetrics. A 14-year-old girl has come to you for birth control pills. Talk to her about it. 44-year-old lady comes with a concern of a lump in her left breast. Take a history, do an examination, and address her concerns. A 39-year-old primeen comes for a checkup at 20 weeks and is found to have a BP of 150 by 100. The urine protein is 3 plus. Take a history and discuss the management with her. A 25-year-old lady is brought at 36 weeks gestation. The fetus is breech. Talk to her about further management. Examine the pregnant mannequin and give your findings. 25-year-old lady has vaginal discharge and lower abdominal pain. You have diagnosed gonorrhea. Talk to her and address her concerns. 18-year-old lady has missed her period by 3 days. She comes with low abdominal pain. Her pregnancy test is positive. Take a history and discuss the management. A mother is concerned about her 15-year-old daughter taking birth control pills. Talk to her and address her concerns. Critical care. 85-year-old lady is brought to the accident and emergency from home care. Her pulse is 120 per minute, BP is low, saturation is low. Take a brief history from home care over the phone and discuss management with the examiner. Abuse. An 85-year-old lady is brought to A&E by daughter with a history of recurrent falls. The nurse noticed bruises. Take a history from the daughter and discuss management with her. ACS. A 40-year-old man who's a smoker comes with severe central chest pain. Take a history, discuss management with him. The ECG is normal. Neurology. A 60-year-old lady comes with a tendency to fall to the right while walking. Take a history, examine, and discuss the management. A 50-year-old lady who's a chronic alcoholic has burning sensation in the feet for 1 month. Take a history, do an examination, and discuss the management. A 50-year-old man has been bumping into objects while walking. Take a history, do an examination, and discuss the management. 25-year-old man comes with fever and severe headache. Assess him and discuss the diagnosis and management with the examiner. A 60-year-old lady is brought by her husband with a history of sudden slurring of speech and mild weakness in the right upper and lower limbs. Neurology examination is normal. Talk to the husband about the diagnosis and treatment. A 70-year-old man with hypertension is worried about developing a stroke. Do a stroke risk assessment for him and address his concerns. Diabetes. A 40-year-old man on diabetic diet has now got uncontrolled sugars. Take a history, examine, and discuss further management with him. The examination of the feet is important in this patient. ACLS and BLS. Do an initial assessment for a man brought to the A&E with a high-velocity trauma. You find a man on the floor in your hospital. Administer basic life support. Breaking bad news. A man brings his 70-year-old father with a loss of consciousness. CT head shows a massive intracerebral bleed. The neurologist says he has poor chances of survival. Talk to the son. A 70-year-old lady just had an aortofemoral bypass surgery. She developed major bleeding in the drain few hours post-op and is rushed back to the theatre. Talk to the son. Pediatrics. A 5-year-old girl is brought by her mother with a history of fall from the sofa. Take a history from the mother and discuss management. An 18-month baby boy is brought by his mother for incessant crying. He's pale and lethargic. Take a history from the mother and discuss the management. We're thinking of intussusception in this patient. A 6-week-old boy is brought by the mother for persistent vomiting. Take a history from the mother and discuss management. We're thinking of hypertrophic pyloric stenosis in this patient. A 10-year-old girl was diagnosed with epilepsy. Take a brief history and counsel the mother. Medical error. A 20-year-old man develops a rash all over the body after being prescribed amoxicillin by you. He was allergic to amoxicillin and you had forgotten to ask about her allergies before prescribing it. Talk to the mother. A 50-year-old man is being discharged after being treated for acute MI. 2 days prior, he had attended the A&E with chest pain but was sent home saying the ECG was normal. Trop T was high then, but nobody followed it up. Talk to the patient. Counseling. A 50-year-old man who developed DVT has been discharged on warfarin. Counsel him regarding his medication. A 40-year-old lady with sore throat for 3 days was not prescribed antibiotics by her GP, and so she has come to ask you for some. Counsel her. A 70-year-old man being treated for pneumonia wants to sign a DNAR order. Counsel him. A 60-year-old man died under your care after being treated with antibiotics for pneumonia. The cause was unclear, so you want to do a post-mortem examination. Talk to his wife about this. Your 22-year-old patient is being discharged after an acute attack of asthma. Counsel her regarding medication and PEFR. A 50-year-old man is being planned for CABG. Counsel him to quit smoking. A 70-year-old lady is diagnosed with colon cancer. She was initially confused, and so the son was told about the condition. Now she has regained consciousness, but her son doesn't want her to know. Counsel the son.